rapporteur. And it's envisaged that Lars will report back to the plenary for us. So we can probably dispense with introducing ourselves. I think we're all pretty familiar with each other from these meetings. So the objective of the session is to unpack how strategic political advocacy conducted at the highest levels could have a catalytic effect and build momentum for effective global, regional and national action for women, children and adolescent health. And Lars is going to brief us on the work that's been done around this concept of a global leaders network, and then we'll get into the discussion. So Lars, I'm going to hand over to you now for your presentation.
Thank you so much, Helen. Can you hear me now? Is there an echo on the line now? Is it okay? Okay, thanks. I'll move on. So maybe we could have my slide presentation on to share now, so that fine. Thank you very much. And then we can. This presentation has been made jointly with Joy Pumafi as the co-chair of the PEC and myself, and with very good assistance from the Secretariat. So I'll start with the next slides, please. Thank you very much. I'll take you through some background, also the rationale and lesson learned from other initiatives, global leader networks that I've been part of, and then a bit about the vision and objectives, expected outcomes, and possible structures. And also, and then we have some questions for discussion. So, of course, this drive, the political leaders' drive for changing women's, children's, adolescents, comes from our strategy, the political leadership, as Helen referred to in her introduction. PMNCH has a success story on this now, and we see lots of commitments coming in. And it's also described as one of PMNCH value adds in the strategy and from where we come from. And of course, we see it's critical to mobilize political leadership and commitments, policies, financing to protect and promote, prioritize women's, children's, adolescents' health and rights. And we see it very necessary within the COVID-19 response and the recovery plans to deliver on the SDGs, the SDG agenda. We also know that political leaders can influence the future global cooperation and reinvigorate inclusive, networked and effective multilateralism, as is the goal expressed by the Secretary General of the UN in our common agenda. And we, as Helen said, there's a window of opportunity now to build back better for sustainability. Of using equity-based approaches to social welfare. Next slide, please. So, as I said, we have some lessons learned, and these we have analyzed and also forms the rationale for what we propose in this and the direction we want to move within this. We see this as a network of heads and states and governments that constitutes an unprecedented legitimacy as elected leaders within the global health and development architecture at global, regional and national level. No other leaders have that legitimacy. And they also come with opportunities to exchange evidence, experiences and insight to build both their own individual and also collective strategic drive and momentum for women's, children's, adolescents' health, emphasizing the high return of women's, children's, adolescents' health investments, which include significant social, demographic and economic benefits. Next slide, please. By setting an agenda, we have a new guest here, so I'll just admit it. A network can crowd a leadership beyond the heads of states and governments by also including and mobilize across sectors and constituencies to foster new partnerships, mobilize alliance resources, and identify innovations for women, children's, adolescents' health. And the concerted action amongst these leaders can also drive multi-sectoral approaches and generating more long-term holistic solutions and sustainable financing. And I'll stop a bit at this slide because I think the latter is very important. There's no other than the heads of state and government that are actually responsible for the entire government. So I think also coming from, I was working with Dr. Tore Godal, whom you might know. He was the Sherpa for then Prime Minister Stoltenberg. In Stoltenberg's efforts and launching the network of the global network of global leaders called at that time, 11 heads of states and government from south and north that were sharing the same vision for women's and children's health at that time. That was from 2007 and onwards. The way we worked, I was the secretary for Tore and his expert group, which were the Sherpas reporting directly to these leaders. We met 4 times a year, every quarter. The agenda was broadly to discuss what was the situation in each country, what were the issues that needed to be addressed, and what were the thinking that we could do jointly as 11 leaders. And then back to the legitimacy of 11 heads of states and governments coming together was very strong. So, for example, you will see we have a picture of 2 of the reports here. One of them was the report from 2009. That was when the financial crisis had a very strong impact at country level, not in some ways similar to now, but different. And then the group decided that the focus now for the next period should be the economic crisis and how to protect women and children during economic crisis. And I'll go a bit into the details so you see how the dynamic here is created, because then we made a report. It was a 2-pager coming from the co-signed by all the 11 leaders, saying something about the need to invest in women's and children's health and building a rationale for that. And at the same time, so this came as a joint message. The Secretary General, Ban Ki-moon, then he signed an opening remark to the report based on the same topic. And each of the 11 leaders, they made their own signed 1-pager about the status in their country, the challenges, and what they wanted to do in the next period. So it was a commitment to the way onwards. And then we also invited in, Prime Minister Stoltenberg invited in other heads of states and governments beyond those 11. I think we had up to 32 leaders in one report. It was a quite amazing, strong report. And we invited in leaders of global organizations, international INGOs, it was healthcare professionals, the partnership signed off a 1-pager, private sector, academia, etc. So it was a very broad group, and this was done through the PMNCH. That's very important. It was the mobilization part of it, beyond the leaders, heads of state government, was mobilized by PMNCH. We used PMNCH as a strategic platform for this. And we also then looked with this group of Sherpas, as we call the focal points of the leaders. We identified what would be the strategic opportunities coming up over the next period, 6 to 18 months in the future. Where should we place these messages? And we launched the reports there. Some of the leaders came to these events, like, for example, African Union, World Economic Forum, General Assembly in New York. So we supported with social media campaigns and so on. So it created a dynamic, and for some reports we also published, like PMNCH already does with the commitments, the commitment and one-pagers from the leader in their own country, so that there was an internal accountability exercise. This movement comes out of leaders' engagement. They are all responsible and accountable to their electorate. They cannot be accountable to PMNCH as an entity, so they have to evolve their own priorities within sharing the same vision for women's, children's, and adolescents' health. And I'll go a bit on now so that you can hear how we think that can happen. Next slide, please. So we see this as it's envisioned in a loosely knit peer-to-peer network of heads of state and government, and they will operate in a coordinated and effective manner to increase investments. That's their job, so to say, on a daily basis for the country. Strengthen policy directives and enhance service delivery for women's, children's rights, health, and well-being, and then delivering on the 2030 agenda. And COVID is, of course, an imperative now. Without solving COVID, we will struggle to build health systems and deliver on UHC and PHC. So COVID is central here. Next slide, please. So, yeah, and I think I already said what is the expected outcome: to mobilize leadership and elevate it and have a broad discourse among governments for PHC and UHC and COVID. And pandemic preparedness plans, that's important, of course. And I also mentioned this, identifying the strategic opportunities. We called it roadmaps, and some of them were made very visual. Next slide, please. Yeah, so what could a possible structure be? As Helen said, it's been decided by the EC that this is not a part of the governance structure of PMNCH. So we see it convened and chaired by a world leader with issue credibility and convening power, including at regional and global level. And we see an amount of 10 members sitting, heads of states and government. It's very important they are sitting from north and south. We have discussed how do we start this and how do we ensure that it's a success, and we have agreed it's the best approach is to do it in an evolving approach, so that we start with one and a few leaders. So it's ongoing some work to identify leaders and see who could be interesting in leading this, and then to add on members in collaboration. PMNCH board chair Helen Clark will of course be very central in this, and she will coordinate and facilitate the Global Leaders Network and have support from the PMNCH Secretariat. The Secretariat, and that will also be based on, of course, the standing committees, will provide analysis of women's, children's, adolescents' health needs and gaps based on evidence-based knowledge developed by partners, as well as other assistance that is needed to support the leaders. It's important that they own this, so the most should come from them sharing this vision. And PMNCH will then also help build consensus and ownership of policies in the various ways to address the challenges delivering on the global strategy for women's, children's, and adolescents' health. And the latter is very important because this is agreed language. I mean, this is endorsed by the World Health Assembly. It comes from the Secretary General of the UN. The Secretary General has asked the UN agencies and actually the 12 multilateral that has co-signed the Global Action Plan to take a lead on this at country level, which is very important for us. So I think we have a strong opportunity there. And I think now the next slide is actually the questions that we would like you to discuss. Can we have the next slide, please? So we have two questions to guide you into this discussion. That is, the first is, how can the Global Leaders Network have a catalytic effect and build momentum for effective global, regional, and national action for women's, children's, adolescents' health. And the second question is, you are well connected as a board members, and so what would be your recommendations for leaders to be approached? Thank you very much, and over to you, Helen.
Many thanks, Lars, and thanks for setting it out so clearly with those slides. So, as Lars says, looking for feedback on how this network could have catalytic effect and build momentum for effective action, and also your recommendations on leaders to be approached, and I guess feedback on the overall proposal. I have a hand up from Lu Wei Pearson. Please come in.
Thank you, Helen, for your great leadership in the different global forum, and we admire your energy and commitment. I'm from UNICEF and leading the maternal, newborn, and child health program in New York. On the two questions, my immediate reflection is how we lead the global leadership network with our ambition of accountability. Government, what do we want to hold them accountable for? Is it allocation of domestic resources to health? Is it continuation of or acceleration of SDG 3? Let's use that example, because more than 50 countries are indeed off track. So are we able to hold them accountable for certain concrete results? And how do we work with like-minded and less aligned partners and countries, right? There are countries having their own struggle, their government not necessarily recognized by the member states yet. They are going through different changes, such as Afghanistan and Yemen and many others. My question is, how do we equip ourselves to work with the more difficult situations, at the same time building greater alliance with the like-minded government and countries? Thank you.
Thanks very much, Lu Wei. Let's now bring in Liberia next. It's in Bento's name, but anyone there, Monrovia? If not, I'll come to Alexandra. Please come in, Alexandra.
Thank you very much. My name is Alexandra Blagovic. I'm from the Interparliamentary Union and representing Mr. Martin Chungong here, who is unfortunately not able to attend the meeting today. He has asked me to reiterate something he mentioned in the meeting yesterday, which is alignment. He is supportive of the idea, but maybe to ask a question about alignment with other similar movements and networks. So, for instance, we know the UNFPA has a high-level commission on the Nairobi Program of Action. The Sun Movement has a lead group on nutrition. Pretty much all these issues are similar, and I think the global strategy, brings them all together. So, if Lars, you can maybe just explain whether this has been coordinated already, whether there are any plans for coordination. Thank you very much.
Thank you very much. Bento, are you there? Liberia there? Come in, you have the floor if you're there.
Yes, thank you. Thank you. Yeah, thank you so much. Yes, I just wanted to say thanks for this presentation. I remember quite vividly the issue of this global leadership network came up when the board met in the Netherlands, and this is of great as this will bring out the high-level commitment to making sure our commitments are realized. I know that this would be a powerful platform if heads of state and are engaged naturally. I know that also this will help us also mobilize additional funding for partner as well as for the government so that the commitment we made for women, children, and adolescents are implemented. I also think what I will say is that we are very, very happy to discuss with our president and while we look forward to the head of the PMNC, Madam Ellen, to help, we ourselves in country will apply our own effort to make sure we enhance the decision-making platform for our president to be a part of this leadership. So on our side, we try to do our best, but we just think this is a very important platform, and this will actually help us to realize the commitments we've made, especially for our adolescent and women. So I just wanted to say that I think this is a way to go. Thank you. Back to you.
Thank you very much. Let me
Hello?
bring in, yes, let me bring in our guest from Nigeria, please.
Thank you very much. And I want to sincerely appreciate the presentation made. It's an excellent one. And for us, it will be a real catalyst for increasing high-level government commitment towards improving the health and well-being of women, children, and adolescents in Nigeria. Though we have witnessed an increasing political commitment by the president himself in the last 18 months towards improving the health of women and children, more additional resources through the Basic Health Care Fund, which is 1% of the consolidated revenue fund of the country, dedicated to improve the primary health care system and also to provide an insurance, a safety net for the vulnerable people, mostly women and children and adolescents. But I think bringing them to that level, especially now in the era of the COVID-19 pandemic, where we have witnessed a lot of challenges in sustaining essential services for this vulnerable group, a lot of focus on the COVID pandemic. I think this would be a huge catalyst to bring back and also sustain commitment of high-level government. And we would definitely encourage the president to be part of this very important vision that is coming up very soon. And also, based on lessons we will learn from there also, I think it would be very helpful for us in Nigeria to come down and cascade to the sub-national level of governance, the key governance at the sub-national level, and also the legislation, because what we have learned positively with the COVID-19, it has renewed kind of commitments of our political leaders, especially the legislators, to have more interest and commitment to the health sector. Recently, yesterday, we just ended COVID-19 pandemic, looking back at the lessons learned and then how we can bring back the health system better than ever before. And we have seen a high visibility and interest from the president of the Senate himself, who participated in the activity, and also some key members of the political class were there. So the interest is there. So it will be a great opportunity for us to harness that interest so that we can get more commitment, sustainable commitment to funding of WCAH in the country. So thank you so much. And I'm here representing the Honorable Minister of Health again today. He has sent his greetings to you. Thank you.
Thank you so much. Errol, please come in.
Thank you very much, and an excellent presentation. I've just a couple of points. We find with COVID that we're losing more healthcare professionals than we ever have before, and we do have a marked shortage of nurses, midwives, OBGYNs, pediatricians, and neonatal nurses. But I think we can combine those. Sometimes our government leaders are not even aware of who the experts in their country, and sometimes bring in experts from outside. So I would simply make the plea as we work with the governments, that we get the healthcare professionals involved, both because it will help with their morale, and two, if we're going to set standards, they need to be very much involved in that. So the healthcare professional organizations stand ready to support, and we support at the grassroots level. But I think if we can get the politicians at the higher levels tied in with their own experts, this would be very, very effective. Thank you.
Thank you, Errol. Susan, please come in.
Thank you. And I'm chair of the DNF group, and I just speak for myself this morning. And I had three reflections to share. But first of all, just to say, I really think this is so critically important, and galvanizing our world leaders behind the agenda is fundamental. And I just really applaud the group for getting our thinking to where it is today. So my three thoughts are, the first one is I do like the word network rather than a more sort of concrete formed group. I think being loosely connected probably is right. There may be times when it's absolutely right that the 10 or so come together and speak as one voice, but I can imagine there are many opportunities ahead where it's just sort of one or two, or just sort of responding to opportunities. So I think the idea of having a loose network is a good one. My second point really was responding to the second question about who to approach. So here's a thought. We were talking this morning about the inference being these are already champions, already signed up champions. And I'm just thinking, if we're thinking about those leaders who are geopolitically very influential, but may not necessarily at this point be the obvious champions, but can be supported and encouraged, and real potential there, and the impact would be huge with some sort of encouragement. So on that sort of spectrum of who to look for, I was thinking we should think about the champions, but thinking about others who there'd be huge potential to encouraging them to become to become more intentional in their focus. And I'm thinking not just domestically, but sort of in their geopolitical sphere they're working, that they operate within. So that was my second thought about who to approach. And the third point is back to the adolescents and there's sort of our raison d'etre that we're about bringing adolescents in. So is that sort of a core principles of working with leaders that we will encourage or ask them to be really focused on working with their adolescents and form really strong partnerships in country. Thank you.
Thank you very much. Interesting point about linking adolescents into the focus. Ana Lilia Jimenez from Mexico, please come in. Are you there, Ana Lilia? Hello.
Morning, can you hear me?
Yes, muchos días.
Sorry. Well, I'm Ana Jimenez from Secretariat of Health of Mexico. And first of all, I want to thank Lars for his brilliant presentation, and to colleagues for the thoughtful contributions. For our government, PMNCH is well positioned to facilitate support at the highest political level. We appreciate that the learnings from other initiatives have been incorporated into the thinking about the Global Leaders Network. Mexico agrees on the idea that leaders have, like Lars said, legitimacy, so they represent a window of opportunity to build forward better for a sustainable future using equity-based approaches to social welfare. For us, it's very important that a network will be able to drive action by influencing and mobilizing peers and other global champions from United Nations agencies, funds and foundations, parliamentary organizations, private sector, and civil society organizations. They will also be able to mobilize commitment and accountability because they can influence the agenda of global and regional platforms to ensure that the health and well-being of women, children, and adolescents remains a priority. We think it's important that the network will be at the highest political level to encourage greater prioritization of evidence-based global, regional, and national development policies. For our government, the network must be coordinated to be effective and increase investment, strengthen policy directives, and enhance service delivery for women, children, and adolescents' health and well-being. We think the contribution of the network at the global, regional, and national action must be based on mutual learnings from the COVID-19 pandemic and in the principles of equity and solidarity. So we encourage PMNCH through this board to continue to strongly advocate for minimizing disruptions in essential sexual, reproductive, maternal, newborn, child, and adolescent health services, preventing and mitigating gender-based violence, and strengthening the role of professional midwives and nurses in the continuum of women's healthcare. From Mexico's perspective, if PMNCH can advocate strategically to protect and promote women, children, and adolescents' rights, health, and well-being, we can place these aspects in national and subnational discourses with strategies that are tailored at different global regions like Latin America and Caribbean. Thank you.
Thank you so much. Vikas, please come in.
Yeah, thank you, Helen. Thank you, Lars, for the excellent presentation, providing us with the necessary context and background for this discussion. I also thank all the colleagues who made very rich contributions to this discussion. We believe that the GLN can play a very strategic priorities of the partnership. I also like the idea given by Susan that it should remain a loose network. However, this network can leverage various platforms and forums to get together time and again, whether it's UNGA, WHA, then there's G7, G20, World Economic Forum. There are many platforms available where we can facilitate interaction among the global leader network, the leaders who are a part of it. In terms of creating some sort of a investment case for leaders to invest their time and effort in the network, we believe that perhaps an approach wherein we acknowledge leadership efforts and celebrate successes through the GLN based on perhaps in a national context, increase in investments in WCAH or significant improvement in the indicators which we want to impact for women and children and adolescent health, and also in the context where the leaderships have facilitated a rights-based approach. These are various things that we are working, that's a common goal to work towards. And I believe that where we find successes in any local, any national or subnational context, I think it'll be a good idea for the GLN to recognize such successes, to celebrate such successes, and maybe felicitate the national leaders of the respective national government or entity. So some sort of an award, etc., could also perhaps be a good idea in terms of mobilizing leadership commitments towards WCAH efforts. Another suggestion would be that we all understand that the national leaderships and the national leaders will always be constrained for time because they are responsible for almost everything in their governance context. I think it will be a good idea if we could have perhaps a nominee of the national leader as a global ambassador. And if that nominee is also adolescent, I think nothing like it. We can then create a a national adolescent leaders network, a global adolescent leaders network, who are nominees of the national leader, leader directly. I mean, that could create a lot of, lot of energy in terms of the partnership being able to communicate to the leadership. So I think that is something that the GLN could think about in terms of how, whether we can do that, and if yes, how to structure it and go about it. I say that in our view, GLN could play a very critical role, and we support the initiative wholeheartedly. Our Prime Minister is already committed to the WCAH, and we're doing so much for the improvement in all the maternal, child, and adolescent health indicators. We've recently come out with the National Family Health Survey and seen significant gains in many of the indicators, and stand committed to it. And I'm sure that India would be very happy in helping the PMNCH partnership to further take up the GLN work. Thank you.
Thank you, Vikas. Now, Helga, I think we have to flick up the
Yep,
slides for our report back.
Thank you for that. Then we're going to share the slides that are going to be presented by Lars at the plenary, which then reflects some of the discussion here.
I think Vikas is the presenter, is he, or is it Lars?
It's Lars on behalf of the group.
Okay. Yep.
So I'd request Lars on my behalf to please present.
That's okay. Okay.
Lars, hope that it's okay, right?
Lars is ready.
Thank you very much, Vikas.
So, Sophie, aren't you? Are we need to project?
Helen, sorry, Helga, I will be projecting from my side.
Yeah, please do it.
Yes, please. Just give me 1 second.
Because we're going to be zipped back without any of us having any control. So we have now 4 minutes, 3 minutes. Oh.
Hi, Helga.
So the first slide just describes actually a little bit what the intent was, which there seemed to be very much agreement on. And then I think we need to then get a consensus on the second slide. Over to you, Lars.
Okay, thank you. It's very hard to pinpoint a few in all these in 3 minutes, but I think I hear that you are very positive to the idea of establishing this network within the framework that we have presented, and you see opportunities. I hear that you see opportunities from countries from Liberia, Nigeria, India, Mexico, which is very supportive for the function of this network. You already have an existing engagement, which is very important and already has been important. So it's something to capitalize on onwards. I think that's important. I think also seeing that the engagement comes from the UNICEF and IPU, the multilaterals organizations, is very important. Weaving this together with other initiatives will also be critical as we move on to see what is the value add of this network. But I think that has to be defined by the leaders as well. But it's an important issue to raise with them. Also seeing the support coming from the organizations, the healthcare professional organizations, is important. It's critical to raise these issues. I mean, resource allocation for health workers is very critical to deliver. We see that in every country. I think it's very critical. And I would like to invite Helga to come in. Helga was very instrumental in making the network of global leaders for Stoltenberg very successful, and also anchoring this with PMNCH. Helga.
Thank you so much. I think we don't really have much time here, but I think we need to get some commonalities between what we've heard from several of the group members here. And one is to I understand networks existing and have either the singular global leader leaders or the network itself work on existing political platforms and how to work with them or influence them in for the women, children, adolescent. So I think what we need is to understand what these platforms are, the AU and so forth, and then UNGA and all of them, and to understand how best to work with them. And I think what we will try to do is to find some common traits and provide 3 bullet points instead of a readout from what each one of you said. I see your hand, Luay. Are you helping with this?
Helga, I just said for the first bullet from UNICEF, perhaps we should take the names of the country away, so that is a less politically.
Yes, I don't think we should present in this way. I think we should find some commonalities.
Helga, can I just? Sorry, are we being zipped out?
Yes, we're being
moving
zipped
in
out.
10 seconds.
So sorry, if I can't see my screen anymore. What